welcome to all of you. And I know that my name on a Saturday morning, you must be all dedicated to malaria. So very happy that you're all here. And let me try to quickly set the context and introduce my fellow panelists, and then we will hopefully have a very good give and take discussion. Last year in Davos, the private sector and development leaders got together to make a business case for ending malaria as a public health threat by 2015. What we were aiming for is sort of a universal coverage of bed nets, indoor spraying, ACTs, and by the end of 2010, and try to eliminate all malaria deaths in the 2015 timeframe we're talking about. In the last year, there has been an incredible amount of progress. We have secured over $2.5 billion in additional new resources to fight malaria. This includes $1.2 billion from the World Bank for the two of the hardest hit countries, that is Nigeria and the Democratic Republic of Congo. And these two countries alone account for about 60% of malaria deaths. And about $1.6 billion from the Global Fund. Overall, you know, a few years ago you could say malaria was a neglected disease. Today you cannot really say that. I think it has received a lot of high-level attention, a lot of funding. And in September, during the UN General Assembly session, leaders such as Gordon Brown, Ban Ki-moon, Bob Zoellick, etc., got together to make a lot of new commitments. Also, now we have a plan. The Rollback Malaria has developed a global action plan, and that has, you know, the idea here is universal distribution, then elimination of all deaths, and eventually eradication. We have all the building blocks that are required for success: political leadership, plan for the first tranche of financing, although clearly additional resources will be needed, and there are many competing priorities that are developing, and we obviously need to make sure that this new money that has come in is well spent and results are achieved. So in a sense, the emphasis has to be effective programs and real value for money. Now, we need to attack this in a very much a business-like approach. We have to talk about how to get this implementation done effectively, what kind of metrics, what kind of accountability needs to be brought in. That is why it's very important, like ExxonMobil with their commitment, working with the World Bank and RBM to develop a global malaria scorecard. Peter Chernin and Rex Tillerson yesterday launched a $100 million capital campaign. This will be very important to raise private sector monies that can then be deployed to make these programs effective, to make the billions of dollars that are being committed spent much better. Also, the role of public-private partnerships. Novartis, in partnership with Medicines of Malaria, is building a legacy of its life-saving Coartem drug and develop Coartem dispersible for children. That kind of public-private partnership is going to be critical. So we have an excellent panel today who can help answer the question that we're going to explore, which is how can public sector leverage the corporate sector to do business of development differently, to achieve sustainable results in a publicly accountable manner. So that's really the focus of our discussion today. So let me introduce the panel. We have Peter Chernin, President and Chief Operating Officer of News Corporation, the chair of Malaria No More. And thanks to him, many wonderful initiatives have been undertaken, including an entire session of American Idol devoted to increase the awareness that was truly effective. Awa Coll-Seck, she's the Executive Director of Rollback Malaria Partnership in Geneva. She's been responsible for developing the Global Action Plan and, of course, the success of recent proposals is thanks to Rollback Malaria and a good deal of technical help they've been giving to various countries. Luisa Diogo, the Prime Minister of Mozambique, welcome. And this is where really the rubber meets the road, action in the field and achieving a great deal of success on the ground and making a real difference. Rex Tillerson, Chairman and Chief Executive of ExxonMobil, has been committed to malaria for 10 years, provided a lot of resources, not only for all the people that are working in Exxon, but their families and the community. Obviously, very important to have that kind of business practices, as we've talked about, bring to bear in this public-private partnership. Dan Vasella, I just talked about it. You know, clearly the pharmaceutical industry is a big part of the solution. What they have done with the new ACT drugs is exemplary, and what's going on in terms of new R&D. And Veneman, Executive Director of United Nations Children's Fund, clearly a commitment that UNICEF has made to malaria, since most of the deaths from malaria are children. And UNICEF in the last couple of years has worked tirelessly to make sure that the right programs are developed, and thanks to the harmonization working group led by UNICEF that has truly brought terrific proposals that has enabled this new funding to come into bear. So what I'd like to do is to simply ask each of our panel members to make a short statement, and then we will open it up for discussions. So I'm going to start with Awa. Maybe you can discuss the progress achieved since Davos last year in securing financing, developing a global strategy, and rapidly scaling up.
Thank you, and thank you for inviting me for this panel. I would like just to say that if we look at financing today, we have never been in this type of situation. 10 years ago, only for malaria and for the fights against malaria in the world, we had only $60 million. Today, in 2008, and since Davos last year, what we have seen is an increase in mobilizing resources with, we can say, reaching around $2 billion this year, in 2008. And this is really something we have never seen. But what we need to say also now is that it is an increase, but we need more money. And it is why, in this time of crisis, economic crisis, my appeal is to say that we need to continue really to put money in this disease, because we have now more successes. And what we will do today is, if we are not increasing the money and continuing to control malaria, we will go back and have epidemic and a lot of problems in countries. This money, I am saying, is mostly from also governments, because they have been putting money in malaria. But for the external donors and financiers, we have the Global Fund, which is really the more important partner in this domain. And as you said, Rajat, thanks to also the Rollback Malaria Harmonization Working Group led by UNICEF and the World Bank, partners together has been able to support countries. And for the Global Fund today, malaria is really the success stories, and the most, we can say, the number or the percentage of success is the most important with malaria. We have the bank, we have PMI, the Presidential Malaria Initiatives. Also, a lot of money is coming to support malaria. For research, it's the same with the support of the Bill and Melinda Gates Foundation. We have also seen a lot of money going to vaccine for malaria research, particularly in support to PATH. And the NGOs and also foundations, all partners are advocating to ensure that these resources will continue to go to countries, because most of the resources are for countries, and this is why really we think that these are today very important. Your other question is also an achievement, I can say, in 2008, to have a real consensus on strategies, and it is put on a global malaria action plan. All partners in this fight agree to work together and support this plan. And I want just to refer to Margaret Chan, the Director General of the World Health Organization. She has been the first saying we need one plan. We cannot have a plan for all the organizations existing. We need one plan for everybody. And this is something all people here agree, that we need this plan to cover all the world, not only Africa. Africa is the focus, but Asia is there, Latin America, etc. We need also to say that this is a plan for the short term, the medium term, and the long term, for control of malaria, elimination of malaria, but also a day, why not going to eradication? This is what is new, and in the domain of financing, but also the domain on strategy. Thank you.
Thank you very much, Al. And if I may ask you to go next, and now that we have these resources, how do we really make it work in the field, and what will it take? How do we get business involved in bringing their capabilities, not only financial resources, but their capabilities to bring, and what role UNICEF and others can play?
Well, thank you very much. And let me first say that I think malaria is truly a success story. When you look not only at the resources that have been put in, but what's happening on the ground. We've gone in 2004 from a global production of 30 million nets to, in 2008, a global production of 100 million nets, projected at 123 for 2009, with financing already secured for 260 million nets. So it is almost possible, with just a small amount of additional financing, to get to universal coverage by 2010. This is a remarkable success story, and this will have an impact on the Millennium Development Goals in terms of under 5 mortality of children, which has already come down significantly just in the last 3 or 4 years, but the success in malaria is not even reflected yet in that. And so I think as we go forward, we have to look at how this global production can be sustained, because, again, one of the things we know is that these nets only have an expected life of about 3 to 5 years. So you have to continue the production to keep the coverage there. I also think that it's important to recognize that not only does this impact the overall child mortality, but it impacts the productivity of the adults that are in the workforce. If the breadwinner of the family has malaria and can't go to work once a week, every 2 months, that's impacting the overall income to the family. It's impacting the productivity of the country. So malaria interventions has a much greater impact on the overall economic well-being of a country. I think also that it's important to, as I said, sustain this effort, to keep our eye on the ball, that as we reduce the overall number of people with malaria, it continues to reduce the spread of the disease. Now, there are threats that are coming. I was in South Africa and Zimbabwe lately. In South Africa, they're worried because malaria is starting to come back in Zimbabwe because of the breakdown of the health system and the breakdown of the spraying program that they had. So I think that it's important to keep a constant watch on what's happening with malaria so that the interventions can be made. Critical also is to work with malaria in an integrated way. We can't look at malaria as just a single approach to health. It has to be looked at in terms of an integrated community-based approach to health, life-saving interventions such as immunizations of children, prenatal care. All of these things have to be integrated in a package for most effectiveness of utilization of resources on the ground.
Thank you. Thank you very much, Anne. May I ask Madam Prime Minister to talk a little bit about specific implementation at the country level, the successes you've achieved, the commitment of especially African leaders to eliminating malaria. Madam Prime Minister.
Thank you very much. You know, since I was a child, I always thought that good leadership should be seen, first of all, based on how the leader looks at the issue of health of its own population. And now I have the same conviction that a leader is a real leader, a good leader, should be concerned with the health of the people of its country and the health of the people in the world. And in Africa, we see our leaders really concerned with this issue. And the situation is improving in terms of how they organize themselves in order to respond to this challenge. And that's why in African Union, we have declarations, we have agreements, we have targets, and we have instructions and recommendations. One of the recommendations is that the budget for health has to increase. Some years ago in SADC, we were speaking about 10%. First 8%, and later on it was 10%. After that, it was 12. Now it's 14 to 15. Mozambique is allocating around 14.5% of the budget resources for health. And when we look to health, we look to the diseases that are the major cause of death in the country. And malaria is the first one. And that's why we embark in a program. We participate in all the campaigns. We are always trying to give our own contribution when there is an organization that's concerned with this issue. Because in Mozambique, we used to lose around 4,000 people per year because of the malaria. And this figure comes from the people that contact the health services. They are the other ones that are not contacting the health service, so we don't have statistics. Because our health service cover around 50 to 60% of the population. And that's why we embark on rollback malaria. And also, we saw that this issue should not be approached only by the government. As Anna was saying, it's not possible to do something really with good results if it's only the government doing that. So we involved the other stakeholders of the society, the private sector, the civil society, and the individuals, those that have influence in the country, showing the face, speaking about malaria, creating and strengthening the awareness about how to face this disease. And we decide with South Africa and Swaziland in our development corridor, the special Lebombo initiative that covers an area, a regional area of Mozambique, Swaziland, and South Africa. It's an area to attract tourism and agriculture and also fishery, and we have the port there. So we decided to do an experiment to see if it's possible really to face malaria and to succeed. So what we did was to put the government doing its own responsibility, putting the capacity in the health service, and also asking the private sector to contribute. So what we did was the prevention, treatment, and we start to work with Spain and other international partners to work on immunization and also to prepare the possibility of having a vaccine. So in Mozambique, there is a research that's being done for that. So on the prevention, what we did was to make the intra-house spray for the houses, and also we distribute the insecticide mosquito bed nets for the population in that area. And we did what Anne was saying about the community-based combat to malaria. And the communities, We prepare people to make the campaign, to discuss with the population, to educate them, to prepare the environment of the communities in order to face this problem of water stagnation or other kind of problems that can create mosquito. And also, we did the prevention in terms of using the radio and television, speaking to the people, using face of the government, political leaders, community leaders, civil society leaders, religious groups, a big campaign in terms of awareness and education. In terms of treatment, what we did was to do also the intermittent treatment of pregnant women in order to make the immunization of the baby. And finally, we did the research in terms of trying to get the vaccine. This is not finalized yet, I think, but I think that we are in a very good direction. So the results came 2 years later. It was fast. 75% of drop in the prevalence of malaria in the area. It was amazing. We couldn't believe. We went to the statistic, we had to send missions and so on, and it was confirmed. It was 75% of drop. And what we did was to use that experience for the rest of the country. As I said, we used to lose around 6,000 people per year because of the malaria. Now, unfortunately, we are losing 1,500 people. But the figure is reducing more and more because when we have more money, we can have more insecticide mosquito bed nets that are very, very important for the program. And also, we can do more spray, intra-house spray, that's very important also for the community. And we can do more and more campaign in terms of education and so on. So I think that's true. What the other two previous speakers have said, Awa and Anne, about the successful case in malaria. What we'd like to have is really the elimination and eradication of malaria. It's not easy. We need to try to, first of all, to control it, to contain it, and to be ready to treat, to test and treat immediately. The fast test is very important for the community also. The availability of this material is also very important. And the training of the people and the capacity of our institutions. And involve more and more private sector. Because the private sector has been showing the willingness and the readiness to participate in this kind of campaign because they have results, not because of just charity. It's because the productivity in the institutions, in the enterprises, when they have healthy people without malaria, is higher. The absenteeism is lower. And the permanent work with capacity, trained and so on, can stay more time in the enterprise because it's healthy. So they have also results and impacts that are positive for the business. So what we need to do is to be real leaders by leading the process, attracting them, calling them to the action, and work together in order to succeed in this endeavor. Thank you very much.
Thank you. As you can see, that real results have been achieved very quickly, and it's also a great example of you can't just have country programs. You need to coordinate. Mosquitoes don't respect our boundaries, so you need to do it in a very coordinated manner between different countries. Let me now switch sort of the emphasis to what can business do and what can business bring. And let me ask Dan Vasella to lead off and talk about the public-private partnership that they have been creating and all the contributions they've been making. Dan.
Well, obviously, one has to ask what are real contributions one can make and where are the capabilities we do have. And being in the pharmaceutical industry, it's obvious that it's treatments or preventions, vaccines. On vaccines, there is work ongoing. One competitor has a vaccine which looks very promising. We ourselves had a combination therapy which we really launched early in the 2000s. In 2001, we delivered about 4 million treatments. We had an agreement, and still have an agreement, with WHO, and last year this grew to 74 million treatments. And it was estimated that this helped to save about 550,000 lives, mostly, of course, children. And children, it's a major issue to give bitter tablets because they don't like to swallow them. And together with MMV, we have developed a dispersible tablet, which we just launched. It's now sweet, tastes like cherries, and they like to take it. And it's also easier to dissolve. You can make a little drink out of it. Which brings me to very practical things which I personally observed. One was that I had a encounter in Tanzania with some nuns in Dar es Salaam who were working with malaria, and asked them what they were using as treatment, and they said artemisinin, which is one of the 2 ingredients, but it's a monosubstance which has a risk of developing resistance, and it's not state-of-the-art. So I asked why they were using the monosubstance, and they said because it's cheaper, your drug is too expensive. And I was surprised because we subsidize the treatment, so we sell below cost at $1 at the time. And she said, no, it's $8. And so I did investigate a little bit more how come that this was $8. It turns out that there are substantial markups in the distribution chain. Second thing, when I went to the countryside, you couldn't find it. So there was nothing available but the very old drugs, which have often 40 to 70% resistance, which seem to be cheap, but if you take everything into account, they're really more expensive. And so I think in our field of treatment, I would say education, the availability of health workers, and pricing and marks up. The whole distribution chain is equally important as to find, again, new treatments. We have engaged also in research in a non-for-profit unit of our research organization, and we are co-funded by the Gates Foundation and by the Wellcome Trust and by the government of Singapore. So it is a very good example of several parties contributing what they have or they know. And I think if we want to be successful, we need a global plan, as it was described, and a common objective, and to ask ourselves who is responsible for which part of that plan, and how we can integrate and then measure progress and learn. Because what strikes me is always that it's more complex than it appears, and we are often far away from the field where things happen or don't happen. And so we need also a certain degree of modesty and really look at what we really know or what we believe we know. Thank you.
Thank you, Dan. Rex, you know, your company is extraordinarily well known for execution, getting results. How do you bring these kinds of business disciplines into a program like attacking malaria?
Well, Rajat, clearly the question of accountability and tracking is essential to continuing to attract the resources necessary to battle malaria. And I think especially in the economic climate we now find ourselves in, the great risk is that there will be a pause in the action. And I think that's what most of us who are involved in this fight fear the most. Because a pause in the fight means we're going to give back all of the ground, and the gains that you've heard have been described, and the fight becomes then even more overwhelming. So accountability at this time could never be more critical in the fight against malaria. The funding has come, but the funding will only continue to come if we can prove the results. So as a business person, that's how I sustain my business, is by demonstrating my results. If I demonstrate the results, I attract the capital. So the fight against malaria is much the same. We have to demonstrate the results. If we demonstrate the results, the donors will continue to come with their investment because the donors want to see that the dollars are producing a result. So the accountability in the result, I think, improving the result is never more important in the fight than it is right now because of the environment we find ourselves in. And we think of this in terms of the fight against malaria as creating what we call the virtuous circle. And it is like the business circle. The investment dollars come in, you provide the result, more investment dollars come in. And it continues as we shrink the size of the malaria footprint on the globe, and in particular, though, in Africa. As business partners, I think what we bring is, of course, we can bring financing, financial assistance to produce bed nets, to support the creation of the breakthrough drugs like Novartis has achieved, particularly for the pediatric treatments. But what's more important is that we bring our business practices. As it's been described, this is a problem that requires an integrated approach. We're a company of scientists and engineers. That's how we manage our businesses, with integrated approaches and systems type approaches. So I think what we as a business community can bring is our human resource capital as well, to put that into the program, working with the health organizations who have the tools and the solutions, but how to deliver those in the most effective way and to measure the effectiveness of the delivery so the system can be improved. So providing the accountability, the measures, the metrics that we can demonstrate to the donor community that their investment in this fight against malaria is providing a return on their investment, is relieving the human suffering that's caused by this disease, and is creating the new human capital for the African continent. That is the real value to Africa, is not losing the human capital that's being lost today with the death of all these children every year. We have to show the results, and I think the business community can bring the systems and the practices of how to demonstrate results to the investors.
Thank you, Rex. Thank you. Last but not least, Peter, you know, in this current economic environment, obviously it is a challenging one, and what can be expected from the private sector at this juncture, and how investment from the private sector can truly leverage the public financing that we are getting?
Well, thanks, Rajat. First of all, I think in this current economic environment, there's a much greater urgency and, frankly, a much greater justification for making contributions to malaria control. I think those of us who are in the business sector, you know, we try to approach investments with a certain amount of rigor. We apply certain metrics, and the primary one is probably return on investment. If you make an investment, what's the return on that investment? And I think that in the world today, there's probably no greater return on investment from human terms than there is an investment in malaria. This is a disease which is arguably, you know, the great global health crisis, and it's a disease which we can improve a little, but this is a disease that we can completely treat, we can cure, and eventually we can eradicate. And I think particularly when times are tough, when resources are scarce, I think it's critical that we apply those resources to where they can have the absolute maximum effect. And I think in that sense that's absolutely malaria control. In terms of what the private sector can specifically do, I think that this is a real tipping point in the fight against malaria. As a number of panelists, Al, et cetera, and spoke, malaria funding has exploded in the last year. You know, we are sitting on the verge of $2.5, maybe $3 billion of malaria treatments and interventions which are about to flow into Africa. We can identify 100+ million bed nets which are getting ready to be shipped to Africa, huge amounts of medications, spraying that's ready to go. And yet, I think, if anything, our challenges are greater than they've ever been, because now I think we owe it upon the people who've given this money, the governments, the institutions, to make sure that these treatments are adequately dispersed to the population, that they're adequately used by the populations at risk. And that's where I think the private sector can play its greatest role. I think that governments and Institutions like the Global Fund and the World Bank have made these resources available, but I think the private sector can play a significant role in leveraging all of that investment to make sure it really gets delivered. And I think that there are really sort of 4 broad areas that we can do that. First of all, we have real challenge in terms of country capacity. We need to provide technical and management support. There are inventory control issues. There are supply chain management issues to deliver. This is a huge amount of goods and services that we have to deliver to a population of hundreds of millions of people. And I think private sector expertise can play a significant role there. Second is just delivery. Just delivering this amount of goods, the transportation challenges, the inventory challenges, making sure that we know how they get there, et cetera, making sure they don't sit in a warehouse somewhere, that we deliver these medications as quickly as possible, that we get the medications to kids in time so that we can save their lives. Huge, huge challenge, and the kind of thing that the private sector does on a regular basis. Third thing is demand creation, or what I would call internal marketing. We have to in some ways activate the populations. Many of these populations have sort of lived with malaria as a part of their lives for centuries, and they're used to getting sick. They're used to a number of kids before the age of 5 dying. And I think it's critical that we activate this sense that there is something that can be done. If you sleep under a bed net, you can protect your child. If your child gets sick, get the medication quickly. Spray the inside of your house, et cetera. And I think that's a marketing challenge, something obviously I know about because I do it on a daily basis. We need to market the malaria control opportunities to the population of Africa. And then finally, I think that we need to keep the pressure on governments. We need to keep the pressure on governments in the West to make sure that we keep these levels of funding. One of the struggles we have is certainly if you look at the U.S. and you're a congressman in the U.S. and you're asked to pass global fund authorization, you don't have a big natural constituency. You don't have a constituent call them and say, hey, I got a malaria problem. We have to make sure that the populations of these Western countries realize that this is the great global health opportunity. So while I think all of us on this panel are deeply, deeply heartened by the enormous progress we've made, I think we really are at a tipping point to make sure that we don't, that not only don't we let this progress slide, but that we bring this to fruition, that we really go all the way with the great strides we've made now. Thank you.
Thank you, Peter. Now we have some real time to get all of you involved, and I know many of you are very interested in the topic and thought about it. You've heard from our panel many different perspectives from our vantage points. So let me open it up to questions from the audience. Here. Please introduce yourself, and please be short in asking the question so we can get maximum discussion.
So we can be long-winded in answering it.
Mike. Yeah.
Okay, Nina Alfie, University of Oxford. I'd like to ask about a threat relating to one of the key tools, the bed nets. As I understand it, there is only a single class of insecticides being used in bed nets at the moment. And we know insects are very good at adapting, they become resistant. The kind of scale-up that you're talking about is really going to give huge pressure to make resistance develop faster. So I'd like to ask what's being done to address that risk, because we could see in the sort of 2015 timeframe that we're actually seeing a significant loss of effectiveness of that tool in some areas.
Awa, do you have a... Please.
Thank you. I just want to say that this is effectively something people are very scared, and people are working on that, particularly with some university and creation of consortium to look at the issue of insecticides. Research now is more developed, and again, a lot of support from the Gates Foundation to the University, specifically of Liverpool, which is today organizing all the university and institutions working on insecticides to have new insecticides to be able to use them for also a new generation of nets. And this is a real problem. It is not yet there, but we need to be proactive to avoid for the next generation of nets to have this problem of resistance. But today, this can be used. We don't have any problem really in the field, but it's sure that in some years, this will become a problem. I know that in Benin, for example, they have already said that maybe they can have some problems. But it is not something a lot of other countries has experiment, and this is really followed very seriously by the community, and particularly by some university focusing exclusively on this type of research.
Thank you. Yes, please.
I'm Marion Bergman, and I'm involved with a small grassroots community-based program in several countries in Africa, and wonder how people on the ground in the community can access the tools to prevent malaria, both the bed nets, the sprays, and educational material, so we can incorporate this into the educational material that we're providing people who come to our community centers. I also wonder, in terms of spraying, many people in rural Africa live in homes that don't have windows, and how effective is the don't have glass or screens. How effective is the spraying in that situation?
And do you want to comment on this question? I'll ask you to
On this,
come back and what
well,
you
let me
did.
first, I think certainly there are a number of organizations who are working to get bed nets into the communities. UNICEF is one, so that, and virtually all the countries that are malaria prone, UNICEF is working in. So I would encourage you to contact the UNICEF office and see if there's a way of cooperation in terms of distribution points for bed nets and educational materials and so forth. I think the issue of education is extremely important. One of the most effective things that I've seen when I've been in the field is some of the work that the Red Cross, the local Red Cross organizations and others do in teaching women on the ground, not just healthcare workers, but actually mobilizing women around what are some good health practices, the importance of breastfeeding, how to use a bed net, how to use oral rehydration therapy for diarrheal diseases. When you use this kind of education approach for women at the community level, and you see the good practices come together in an integrated way, you often see child mortality come down significantly. And so I think these are the kinds of education approaches that we need to look at and go forward with. What was the second question?
Spraying without windows.
Oh, the spraying. I'm not the expert on that, but my understanding is by spraying the walls so that the mosquitoes, if they land on there, it can be quite effective because in addition to an insecticide-treated bed net, I mean, what you want to do is keep the mosquitoes away from humans and give them that barrier, and by spraying the walls you do effectively control the mosquitoes as well. But others may want to comment.
Madam Prime Minister, would you like to add?
Yes, thank you very much. I think it's a very, very serious question, because the access to bed nets, it's really not easy. For example, in Mozambique, we would like to have bed access, because in the place where we have the market, it's around $2 per bed net. And if we consider that 54% of the population in Mozambique lives with less than $1 per day, it's not easy to find $2 to buy a bed net. And for the other places, we have $3. For example, Mozambique is a long country. In Maputo, that's the south part of the country, the capital, it's cheaper. But if you go to the north, like Niassa, it's very, very expensive. $3 per bed net. It's not easy. So I think everything that can be done in order to make it more accessible, it's really welcome. On the issue of intra-house spray, our experience is that when the mosquito comes and go to the wall, has said, there he has to confront with the insecticide there. But after that, we have the bed net that also protects the family. For the case of pregnant women and the case of babies, when you come from the maternity, you have the right to receive one bed net for you and for the child, for the family, that close family, not for the other child like the 3 or 4 child that you have at home, but for the people that are close to the baby. So we are trying to use in a more effective manner what is available, but still a problem. And that's why I really like what has been said about the possibility of making these vertical funds more effective and more rapid to be used. Because the procedures and so on are not easy. And my Minister of Health has been always complaining about that. I've been telling him you have to be patient, you have to discuss, you have to dialogue, but you know, medicine doctors normally, they are not so patient on dialoguing when it's an issue of saving lives. So he comes to my office, he says, I'm really upset with these vertical funds. And no, you have to go again, discuss with them, and bring the money. So we need to make this money really fast to be used and to be more effective. Thank you very much.
I just want to add a couple of things. In the Global Fund, and Michelle Kazakhstan, the executive director, is sitting right there. We have, in the last couple of years, said that we not only want to channel the global funds through public enterprises, but also through civil society and private sector, which really gives the opportunity for civil society to work with the country coordinating mechanisms in each of the countries and apply directly for grants and actually make that happen. The other observation I'll make is that I was recently in Ethiopia for 3 days touring around and looking at the effectiveness and implementation. There is no question that the community health worker is at the heart of it in terms of just the education as well as compliance. What would be the worst outcome would be we would get universal availability of bed nets, but they won't be used properly. And I've seen community health workers launch programs where not only do they educate, but they actually monitor compliance, going there, visiting homes at 5 in the morning and saying whether they're sleeping under bed nets and that kind of thing. And that's the type of thing that will make this program really work. Other questions? Yes, please.
Luke Alfie from Oxtec in the UK. It's about prices and access. The point you made about, Prime Minister, about bed being different prices in the country is important, but I thought Mr. Vasella's comments about the Novartis drug, ACT, very effective drug, provided at a subsidized price by Novartis, but the benefit and the point of providing it at a subsidized price is substantially negated if it ends up at 8 times that price when it's actually available to the person who needs it. So the question, of course, is what can you do about it, or what, in your particular instance, in that particular case, what are you doing about it? What did you do about it?
Yeah, I think, first of all, from our side, of course, the objective was to find ways to make it cheaper and cheaper. So it's at 80 cents now, and for children it's about 37 cents. But the problem is we do not have a control over the distribution chain. And so we need to be very clear who is responsible for that. And I think the government has the responsibility to set rules into place how this should happen, and then to see the possibilities of enforcement, which they do have or don't have. And then you have to ask yourself, between the private sector distributing and making profits and a public sector doing certain distribution points, I think these are questions which government needs to ask itself and look at and make a plan. And I would be very much in supporting Rex's point, which is, and then when you do that, pilot, measure, learn, and improve. And so you get into a certain cycle. And I'm sure, I think, unfortunately, it is not only knowledge, it's afterwards discipline of implementation. So, but there is a commitment which needs to be happening.
And I think this is an important example of why, of the importance of measuring and having metrics and accountability points throughout the entire system. And it is very much like a supply chain and a logistics chain issue. but you have to measure every step, because if you're only measuring the endpoints, you really don't know, and I understand the endpoint is, are we seeing reduction in deaths from malaria? Are we seeing reductions in cases of malaria? That is the ultimate measure, but the measure of the effectiveness of the system is measured every step along the way. And that requires taking these metrics to the local level, because that's where you're able to really detect if you have a supply chain inefficiency, to put it politely, that then allows the organizations that are providing the funds and providing the tools to intervene with the local government, whether it's the Ministry of Health or it's the local authorities, to break that inefficiency in the chain. It requires intervention. That's the way we improve a business model, is we intervene to find the inefficiency and we correct it. So I think this is it's a very good example of why the metrics and the metrics assigned to an accountable point are so crucial to the ultimate success. And it starts at the big picture level, but ultimately you have to translate it all the way to the local level.
I just also make you aware of a program that's just going to be launched called AMFM, which is Affordable Medicines for Malaria. And the idea here is to ensure what we just talked about in terms of universal distribution and the supply chain problem that's been created, have it available not only for public channels, but also private channels at an affordable price. And this is going to be housed in the Global Fund. It's going to be funded significantly by many donors, but also UNITAID, which is providing the initial funding for it. And it's going to be piloted in 11 countries to just do what you just said. Let's pilot, let's learn how to make sure that the endpoint pricing is affordable, as the pharmaceutical companies are making a great contribution in making sure that they are manufactured and available at a very reasonable price, but the endpoint has to get there. So that's being done right now. One last question, then we'll get into some summaries. Any other? Yeah, here you go.
Yes, to Rex Tillerson. I'm Paul Eckley from State Farm. What are the biggest supply chain issues from ExxonMobil's point of view in the malaria issue?
Well, it is the delivery system, and we the mechanisms of how malaria is transmitted, why the disease propagates, why it continues to exist are very well understood. The battle is fought on two fronts, and it's prevention through the bed nets and it's treatment through the drugs. And the biggest supply chain issue is the delivery system itself. And many people have touched on that in terms of how do you get the bed net into the hands of the right person. And what we know is that right person is typically the mother, because if you put it in the hands of the father, it may get bartered for something else. And that's just an unfortunate fact of life. How do you get the treatment into the body of the child is largely an educational issue. Mothers have to know that the treatment's available, and they have to know where to go. So I think one of the important elements of the supply chain is the education piece. Until you can get the awareness out to the mothers in the community, then that's the first step. Till you overcome that one, then all of those tools are, that's why they sit in the warehouse unused. That's why the medicines don't get distributed. It's largely not because people don't want them, it's largely because they're unaware. And so I think the first most important challenge in the supply chain is the education.
Any other thoughts on this particular question? I just add one thought to this. I think one of the challenges, of course, here is the generally the entire health system and the delivery system and the governance of that system in many countries. If you think about a complex country like Nigeria with many states, and where does the health governance structure reside, and how do you actually go from the community level programs to a national program, and how that gets delivered in such a complex political and administrative structure is something that needs to get navigated, and that will be very, very important. I think one issue that, and I come back to this question of role of the private sector and being able to bring the best management practices, governance structures, help do that so that the effective delivery can take place. And that's why I'm so excited about the capital campaign that Rex and Peter launched yesterday, because I think the software dollars, in a sense, is actually equally important to the, the medicines and the bed nets and so on, because you're going to construct a very complex house, and if you don't have the right architecture to begin with, you might have a problem in the structure itself. So I don't know, Peter, you want to comment a little bit on that, because I know you've spoken a lot about this management.
Sure. No, I think it's helpful just to specifically, Rex and I and Peter Sands, who was the CEO of Standard Chartered Bank, announced actually here yesterday the formation of a malaria capital campaign. We're, I guess, crazy enough to say we're going to go out and raise $100 million from the private sector in this environment for the support of malaria. And it's very much to address the issues we're talking here. As I said earlier, we have the tools available. We have the money now to create and supply those tools and basically ship them to the edge of the problem. We now have to get them from a port or from the border or from the local city into the individual's hands. And I don't think, I don't think you can underestimate just how challenging these supply chain issues are. There's not a local 7-Eleven with a guy driving a truck there every day. We have to be incredibly creative, incredibly opportunistic about looking at different ways of delivering goods and services into people's hands. We need to use the faith-based community. We need to use the healthcare worker community. We need to piggyback on existing NGOs, UNICEF, the Red Cross. And I think and there's no easy roadmap that says this is the way you deliver bed nets because each one of these countries is different. But I do think it is clearly an area that needs some private sector resources, because governments are going to buy the bed nets and governments are going to buy the drugs. Private sector resources need to solve these problems. But not only the resources, but also the expertise. The expertise of an ExxonMobil. I've been talking to Procter & Gamble, a phenomenal supply chain management company. I've been talking to Walmart, arguably the best supply chain manager in the world, about not only how do we get the private sector to give us money, but how do we get the private sector to also give us expertise? And then finally, on this area of sort of demand creation, we need to educate the population to demand these tools. And as I said earlier, that's a marketing challenge. And look, that's something my company knows about, and we've been contributing a lot. We're about to send American Idol finalists into Africa. We sent Kiefer Sutherland into Africa. We're about to do a big campaign with leading up to the World Cup in South Africa in 2010, trying to galvanize all the football teams in Africa. We have Youssou N'Dour, arguably the biggest star in Africa, working for Malaria No More. So I think there aren't easy answers that you just go off your checklist like we do with many of the problems in the West. But I do think that there's great expertise on the part of the private sector, and we need the private sector to give us great contributions. And, we had a kickoff contribution of $10 million from ExxonMobil to this campaign. I think we're close to $40 million already, but we're going to get $100 million of private sector money and expertise focused on this problem.
Peter, thank you. That was Peter's summary comments. I'm going to ask some of our other panel members to say their closing comments, and then we'll wrap up the session. Anne, would you like to start?
Well, there's not much to add, but I do think this is an incredibly important challenge, one we're making progress on, but one that has to be looked at in the overall health challenges of the developing world. The other thing I would add is that we have to also look at malaria not only in the context of global health, but also in the context of some of the global challenges. One of the things that's a big issue in the global environment today is global climate change. Global climate change has the potential to increase the areas of the world where malaria can be a problem because of potential temperature change. So I think we have a tendency to look at these issues, to look at them each in their own little space, but the importance of integrating them all together and looking at the interconnections, I think, is one of the most important challenges we face as well.
Thank you. Awa, would you like to?
I would like to add just that what we have said since the beginning has shown the importance of partnership, working together and working in an harmonized way. But also the issue of coordination. We have all the sectors now really involved, from the civil society to the private sector to government. Everybody wants to do something. And if we want to do that, we need also to coordinate everything. And the last point I would like to add is that we need to look at malaria as a real entry point if we want to resolve and to reach the Millennium Development Goals. Malaria having an impact on education of children, child mortality, women health, poverty. Don't forget that every year Africa is losing 12 billion because of indirect cost, only because of malaria. Now, malaria can be really a sort of entry point, success stories, really for the MDGs too.
Thank you. Dan?
Nothing to add.
Madam Prime Minister.
Thank you very much. I would like to thank and congratulate all the institutions and organizations and countries that are really involved in this combat to malaria. It's a very serious issue. It should be seen not only in terms of health, but in terms of economic impact in our continent, in Africa, in our countries, and also should be seen as something that comes even in terms of being a very usual opportunistic disease for HIV/AIDS. Malaria is exponential when there is HIV/AIDS surrounding the country. So it's something that should be looked at as a priority in terms of health, but also as an important issue to be handled in the context of development of our countries. Thank you very much.
Rex.
Well, I hope what you've taken away from this session is that the financial resources are now arriving, the tools are arriving, and that it's so important now more than ever, as Peter put it, and I agree with him, I think we are at a tipping point in the fight against malaria, that we not allow the current depression that exists in the world today around the economic situation to slow us down, to cause us to pause, or to cause us to step back. Otherwise, we will waste this wonderful opportunity we have to eradicate this devastating disease that's robbing Africa of its most important resource, its future human resources.
Let me close by saying that I've been involved in this for the last 2 or 3 years, and I cannot tell you how gratified I am to see all the players come into this fight. And it's quite an extraordinary thing that has happened in the last couple of years. We need to keep the momentum. We need to ensure the results so that, as Rex said earlier, we can get into this virtuous cycle. I think we also need to avoid many false debates, like, you know, these vertical programs versus an integrated program, health systems versus malaria. These are not real debates, because I think attacking malaria strengthens health systems. It frees up the health system for other diseases and so on and so forth. So this is a moment where I think we can all be proud of what has been done, but there is a huge amount to be done going forward, and it is up to really all of us to make sure that it happens. And I want to thank this outstanding panel from various fields who have come together in this fight. Thank you very much for coming.